you ever wondered how patients undergo surgery without feeling pain? Today, we'll be talking about the importance of this medical topic, anesthesia. What exactly is anesthesia and how does it work? What really happens when you go under? How safe is it? And how can you prepare your body for a smooth experience and quick recovery? Stay with us as we will be finding out. As always, you're welcome to the program, Your Health, where we give you valuable insight into health, wellness, and everyday well-being. I am Salamat Ozioma Lukman. Before our discussion today with our doctor, let's look at these wonderful fruits that can help your body prepare for recovery from anesthesia, and we'll be right back. Those were the benefits of bananas, oranges, and apples. Remember, healthy eating before and after surgery supports smoother anesthesia and faster healing. Now let's meet our doctor, an expert in the field, as she helps us understand anesthesia even better. She will share valuable insights about what really happens when a patient goes under. Let's take a listen. I'll be right back.
Anesthesia simply means loss of awareness, and what it's all about is is being carried out before any surgery or any procedure is done for a person. So, the person will not be aware of what is happening. The holding anesthesia, they've done a lot of things. Some they've used alcohol, some they've used big stone. I mean, it's the patient on there so the patient lose consciousness, and we've actually grown from that ancient and barbaric one to what we now call modern anesthesia, which is still without awareness and pain. And what we normally do is during surgery, patient will be asleep, which is referred to as general anesthesia. And there are some other things we can do. The patient might be awake, but there will be loss of awareness or loss of function in that area that the person is working on. And that's what we call either regional or local anesthesia. And that one, patient will be awake, but they won't feel pain or feel anything while the surgery is being carried out on them. I'll start with local anesthesia. This is done where you numb the place that you want to work on. It's normally carried out by use of drugs, which we call local anesthetic agents, which can be injected in that area. There are many ways of us doing it. Now, modern way of doing it include using maybe ultrasound to be able to detect the nerve you want to block, and that one will be accurate. Before, we used to use anatomic position, where you know the anatomy of the nerve you want to block and you block it. But with the use of real-time ultrasound, you'll be able to see the nerve you want to block and target it, and that one prevents a lot of side effects because you actually know where you are blocking. So it can be used for a lot of procedures that they will just inject on that nerve, and that will take care of the pain and the surgery or the procedure can be carried out. Patient will be awake. There's also regional anesthesia, where we have spinal, we have epidural, we have different type that we can do. That one, when you inject these local anesthetic agents, it does the same thing. People will not be able to move, you will not be able to, you can just feel touch, but you won't feel pain. And that one can be used to do for surgeries below the umbilicus, many type of surgeries, cesarean section, some myomectomy, some orthopedic surgeries. So you can use either spinal anesthesia. That one is a single shot. For epidural, a catheter is passed into the epidural space, where you can be doing top up with those drugs, so that one can last for a longer time, for a longer surgery. And most of these surgeries are those below the umbilicus. You can use it for lots of surgery: urology surgery, gynae surgery, cesarean section, orthopedic surgery. A lot of surgery can be done using that. The patient will be awake, but they won't feel pain where they are working on. And the third one, general anesthesia, that one is when the patient is asleep. And it has evolved to, we now have very short acting drugs and very good drugs that when we give, the patient can be asleep. We take care of the airway. There will be a machine, ventilator, that will be breathing for the patient while the surgery is being carried out. And this has led to a lot of complicated, complex surgery that can be done. And because we now have a lot of drugs that are with little side effects, that we can use to get the desired thing we want for patient will be asleep, and a lot of surgery can be carried out, even on the heart, on the brain. A lot of surgery can be carried out with general anesthesia. Anesthesia has grown so wide now, and the work of anesthetist, apart from working in the theater to give the various kind of anesthesia, most of the time we are also the one that work in intensive care units, because we have the knowledge of the airway and how to take over the airway, how to resuscitate, how to manage very critically ill patients in the intensive care unit. And also we also do a lot of sedations out of theater, in the MRI, in CT scan, especially for children, because they can't still when all these procedures are being carried out of them. And then some oncology patients too, we sedate them, so for them to have their procedures or their drugs or anything they want to do for them. So anesthesia is like a very vital branch in an hospital, because it's like we cater for the entire hospital. Apart from working in the theater, we work in intensive care units. We also do resuscitation. If there's any patient that is we are like the emergency response system in the hospital. If there's any patients in the accident and emergency, in the resource, in trauma, we're still the one they will call, so that we can take care of the airway and support the patients while other investigation is going through, or before they move the patient to theater, or before the patient come into the intensive care unit. So our work is more of service delivery. We service almost all the departments in the hospital. And now anesthesia we are going to subspecialties. There are some that are doing trauma anesthesia, that's a subspecialty. There are some neuro anesthesia, that the one that go ahead with any anesthesia involving the brain surgeries. There is cardiac anesthetics, where there is even open heart, where they can operate on the heart, and you have to give anesthesia for that. General surgery, urology surgery, gynae, obstetric. We covered a lot of different kind of procedures that are being done. So generally, that's what anesthetists done. There are also some in academic that are teaching future anesthetists, and a lot of modern things is coming up now with AI, artificial intelligence, and all stuff that is coming up. And anesthesia too is not left behind. For children, I'm even a pediatric anesthetist. So there's because most things in children are not well developed, their brain, their kidney, their liver. So most times for you to carry out anesthesia on them, you have to be very meticulous. That's one thing about children. You have to be very meticulous. You know their weights. You calculate their drugs based on their weights. You can get away with some adults, but for children, they will not forgive you. You have to calculate, know the weights, calculate the drugs, your tiny, all your equipment you are using for them. Make sure it's one that is appropriate for them. And then you have to be very serious and meticulous when you are anesthetizing children. In fact, for children, you might need like 2 or 3 anesthetists, especially if it's even very small, tiny children, premature children, neonates. We operate on those kind of, and give anesthesia to neonates, a day old, a month old. Some are even less than 1 kg that they need some type of surgery, and you have to operate on them and give anesthesia for such babies. So one thing about them is that you have to be very delicate. Know the drugs you use for a child, know the equipment you use for them. You have to monitor them seriously and have to be on your toes. For even the smaller the children are, the more you need more anesthetists, more experienced anesthetists to take care of them. And it's just for us to want to take precaution. And the same thing goes for elderly patients. For the same reason too, the immune system is down, they have a lot of comorbidities. So for them, to the drugs, you might need to reduce the dosage of these drugs for elderly people. And then you have to monitor them and take cognizance of that they might have other medical condition, diabetes, hypertension, which you have to give attention to when you are assessing such kind of patients. Okay, so some of that's what we do when we go and do pre-anesthesia review. That's when you will have taken history of the patient, know if there's any comorbidity, know if the patient is on any drug, because some of our drugs might interact with the drugs the patient is taking. So you have to know what drugs currently the patient on. If he's an hypertensive, is he well controlled? You have to order some investigation to know the condition of the heart and know which kind of drugs you can give to this patient that will be cardiac heart friendly, that will not make the patient to suffer more while they are under anesthesia. There are some investigation you carried out to check their heart, check the liver function, check the kidney function, and if they are patient that's on dialysis, some they might need to have the dialysis before they come for anesthesia, so that the patient is in optimum condition. What we normally say is that we optimize the patient before the patient come for anesthesia, and then we tailor it according to the patient. You don't just give the same thing to everybody. You tailor it according to the need of the patient. So most of the time, what we normally do, we do it pre-anesthesia, know and plan for this patient. And then when we have planned, when the patient comes to anesthesia, we monitor the patient very well. We make sure we've tailored what patient can take, and those things that we think will be deleterious to the patient, we try and avoid it. And after the surgery too, we still do post anesthesia review on this patient to make sure the patient is fine. So when people are under anesthesia, most time what we take care of the pain, analgesia. We take care of we prevent movement, we prevent awareness, so that people don't know what's going on when they are doing the surgery. And then the most important thing we do is, as anesthetists, we monitor the patient and even the surgeon and everything around us. We try to be like now that we have a lot of monitors that can do it for us, but the presence of an anesthetist is so important, so that we can notice if there's anything going wrong. We monitor the heart rate, the saturation, oxygen saturation of the patient. We monitor the urine, monitor blood loss, monitor the ECG, the heart, while surgery is being going on. And all these things have led to a good outcome in most of our cases now, because of the modern equipment we have, the drugs we have, and the monitoring. We have gadgets, lots of monitoring that we do for patients under anesthesia. We actually, we have to, before we do anesthesia, most of the time we do the pre-anesthesia check, where we'll have checked everything about the patient, taking history, examine the patient well, do some investigations, and then we'll be able to determine what anesthesia can we offer to this patient. And because some patient will come with some other ongoing medical illness, hypertension, diabetes, some have cardiac disease even before they come. So all these things we need to take it into cognizance so that we tailor it to individual need of the patient, what the patient will actually need for their anesthesia, if it's the one that is amenable to local, if it's the one that is amenable to regional, or if it must be general anesthesia. All these things will have to be taken care of when we go and see the patient, even before the anesthesia. The intra hop, when we are carried out the anesthesia, because we have already developed a plan. We've already developed a plan, know what's suitable for this patient, what we are going to use for this patient, and how we are going to monitor this patient. So intra hop, all the things we are envisaging, any if you are envisaging any problem or whatever, we will have taken care of that and will have prepared for it. Some of the common side effects, especially for like local anesthesia, is when you are not using the ultrasound. That before that we used to do most time anatomical, you might miss the nerve you are supposed to block, or block more than what we are supposed to do. But with the advance of ultrasound is now, it has limited those side effects. And sometimes, if you cause much, if you don't know the place you are blocking and you are just poking and poking, can cause some hematoma formation, which can not make the patient to actually have the anesthesia effect we want the patient to have. Then also for regional anesthesia, when you are doing spinal, there are some that can cause, there are some referred to as they can have some headaches, and but that one is being prevented now by the kind of spinal needle we are using. We're using very small tiny spinal needle, so those side effects has been we don't see it much. There's also what we call hypotension, where the blood pressure can drop, but before we do that, we try and preempt that, and before we give spinal anesthesia, we'll have preloaded the patient, give the patient enough normal saline, have drugs for resuscitation at hand. That's one thing we do. Before we do any anesthesia, we prepare for all eventualities. We prepare drugs for resuscitation, so that if there's any issue, we have it at hand and be able to take care of it. And other side effects could include high speed for spinal anesthesia. Can be high, which can be more than the level we want, and the patient might not be breathing well. That one, we have to take over the respiration of the patient and give the patient, make the patient to sleep, so for the effect to wear off. And then, but most of these things they are not commonly seen because we'll have prepared for it. For general anesthesia, most of the time, that's when we give drugs. Most of our drugs these days, they are short acting, and that's why it's good for us to do pre-anesthesia review, so that you'll have tailored the kind of drugs you give this patient. Those that the patients are not supposed to get, like an hypertensive patient, that some drugs you don't give such patients, because some of our drugs can cause hypertension, some can cause hypotension. So that's why we tailor it and make sure that we are not giving the wrong drug to the patient. So what I would just advise for us is that when you are to come for a procedure, ask who is your anesthetist, so that you can have this discussion, for you to debunk all these myths, so that you can be well informed. You can ask all the questions: what's going to happen to me, what are you going to do for me, how is my pain relief. That's another thing we're known for. We take care of the pain, so we try and that's another part of anesthesia that is going pain and even palliative care for those that are patients that they have chronic conditions. Some is chronic condition, some can be cancer, and most of what they present with is more of pain. So those are some of also the things we are trying to debunk. They can be given good pain relief, so that they can at least have good preservation of life.
Thank you very much, Dr. Morayo Salau, for those clear and reassuring explanation about anesthesia. It is comforting to know how much care goes into keeping patients safe before, during, and after surgery. Now let's take a moment to watch some health tips and we'll be right back. Your body recovers best when it cooperates with your mind and medical team. That is why understanding medical procedures like anesthesia is also very important. It helps reduce fear and builds trust. Now let's take some facts on our Did You Know segment. I'll be right back. Amazing, isn't it? Science and medicine have come a long way to make surgery safe and almost, painless. We'll take a short break and we'll be right back. And now it's now time for our feedback segment where we take your comments and questions. And if you're just joining us for the first time, you can also be part of this by sending your messages to the numbers displaying on your screen. Today, our question is coming from Aishat, and it goes, Aishat from Karo, and it goes, I've been struggling to drink enough water daily. Please, what is the simplest way to stay hydrated? Well, Aishat, here's our doctor's reply, Dr. Chima from Federal Staff Hospital. He sent this via text, and it goes, great question, Aisha. The trick is carry a water bottle everywhere and take small sip often. Your body will thank you for this. Another question comes from Tunde in Koba, and it goes, sometimes I wake up tired even after sleeping for 8 hours. What could be the reason? Here's our doctor's reply also via text, and it goes, Tunde, poor sleeping posture or stress could be the cause. Try sleeping earlier, avoid screens before bed, and check for snoring or breathing issues. And finally, Aminat from Gariki sent this comment. I love how your program explains medical topics in simple language. Please keep educating us. Well, Amina, thank you. We truly appreciate, your comments. It keeps us going. And this I will be taking on our question and answer segment today. We'll take a short break and we'll be right back. We hope today's discussion has helped you understand anesthesia better, what it is, and why it is an essential part of safe and successful surgery. Always remember that good communication with your doctor healthy habits, and a calm mind go a long way in ensuring a smooth experience and a safe, faster recovery. Thank you for staying with us today. Join us again next week for another exciting and enlightening topic. Until then, stay safe, stay healthy, and do have a lovely day ahead.